I'm sorry, guys. I've been talking the whole time on mute. Good morning, everyone. Welcome to the Mason Square C3. I just said a lot that I'm going to repeat. So today we're going to have our Mason Square C3 meeting, go over the COVID-19 vaccine. We have a wonderful panel lined up to talk to you all about the COVID-19 vaccine and answer some questions that were sent to us, give you some information up front, and then answer some of the questions that you all have. And so that's going to be great. And before we do that, Richard is going to cover some ground rules. We're going to talk about the format of our traditional meeting, which is not going to happen today, and talk about and introduce the panel and get started. And so, Richard, if you want to just chime in to go over the ground rules, and I don't know if you want me to cover the traditional way the meetings run, or you could just run right into it.
Okay, I'll cover the ground rules and then defer to you for the traditional meeting. Good morning, good people. So want to thank you all for joining us. We're looking forward to having a very lively conversation and informational session for you. Some of the ground rules that we want to just go over is just be mindful that one, we want to think about our questions in advance so that we might be able to be as concise and direct with our questions. In the event that a question kind of turns into a statement and we're kind of using a lot of time, please don't be offended if I interject and ask you to close your question so that it might be answered. The idea here is to make sure that we get in as many questions as we can and resolve some of the issues that people might have around some of the information that is presented. Want to encourage you to be mindful that we can still use the chat. Any questions that you might have that go unanswered, the intent is to make certain that we come back to you at a later date and provide you answers to whatever questions that should have been answered or could have not been answered during the presentation. Want to say that we do have an extended meeting today. We're going to go until 12:30, but that time is going to fly by since we have such an illustrious panel and a list of presenters for you. So we want to remind you that what you see on your screen now is all of the methods or ways that you can join us and that you can share your information and that you might participate. Want to encourage you to raise your hand, and that's the little gold hand at the bottom of your screen. If you're working from a computer or a desktop, you can look and move your cursor on the bottom of your screen and you'll see the gold hand that stands up. If you press that, we'll try to take your questions in the order that they come. And I think that that's going to be pretty much it for the housekeeping issues. Just want to remind you that after each speaker, what you just seen in terms of instructions, those instructions will be put back on the screen just to kind of remind us how to participate for those of us who aren't as computer savvy as others might be. With that, I'd like to say, traditionally, we do begin the meeting with a moment of silence. I want to take the opportunity to do that now and then turn the meeting over to Tracy. Thank you so much. Go ahead, Tracy.
Thank you, Richard. And just to piggyback on what Richard said, if you have a question that's not answered, you can put it in the chat, but you can also email it, and Nicole will put the email in the chat so you could see what that email is, and you could email your questions and we will circle back to you at a later date. And so just to reiterate how the Mason Square C3 meetings usually run, we start off with a moment of silence, and then we give a police report out of anything that happened in the Mason Square community during the week. And so they report out on the good and the not so good things that happen in the community. We ask questions about the events, and then we give a overview of our goals, the Mason Square C3 goals. And we have a facilitators report out that usually comes from Richard or I. Nicole will give an administrative report out. So we talk about anything that Mason Square C3 is doing in the community, any follow-up details that we need. If you want to share any events, you can send them to Nicole through our Mason Square C3 email. And then from there, we move to the participants. You tell us about your organization that you're with, or if you're a resident, you ask the officers at that time, anything that you see in the community that you want them to investigate, that's the time that you do it. And the officers will normally report back on their findings the following week or weeks to come. And then if we have any one-off events, we save those to the end because we do have a lot of participants each week and we do like to get around the room. However, today we have a wonderful panel that is going to discuss the COVID vaccine. We're going to try to dispel myths. And here are our lovely panel, Commissioner Helen Carlton Harris, Dr. Esteban from the Infectious Disease Department of Bay State Health. We're going to have Phoebe Walker. I'm sorry, my screen is covering their titles. The Director of Community Service for Franklin Regional County of Governments, and Lindsay Tucker. She will be joining us later around 11:15, who is the Associate Commissioner of the Massachusetts Department of Public Health. So she works on the state level. And so we are so glad to have all of them. And before we get started, I'm just going to read all of their bios in the order that they will be speaking. And then we will turn our attention over to Commissioner Helen Carlton Harris to kickstart the panel discussion. If you have any questions for her, please put them in the chat or raise your hand. We also have folks following us on Facebook and YouTube. We're going to be monitoring YouTube questions, not so much Facebook, but the Mason Square C3 questions will come first. The ones that were sent in via email are first, then the participants of the Mason Square C3, and then we will move over to the YouTube questions if time permits. So here are the bios, and they are really condensed, guys, because I would have been here forever if I read their whole bios and all their accomplishments and all the boards that they serve on. So I'm really just going to give a high-level overview on what each of the panelists does for the community and for the city and for the state. So Commissioner Helen Carlton Harris is the Commissioner of the Division of Health and Human Services for the City of Springfield and the first Black woman to hold the title of Commissioner of the Division of Health and Human Services. In that capacity, she is responsible for the administrative oversight of 4 city departments: Veterans, Elder Affairs, the Thomas J. O'Connor Animal Control Shelter, and the libraries. She is also responsible for the direct supervision of the Springfield Department of Health and Human Services and the Health Services for the Homeless, a 330 federal funded health center. She has played a prominent role in developing policies for the health and human services needs of the underserved population and the local and on the local and national levels. The second panelist is Dr. Esteban del Pilar Morales. He's an infectious disease specialist at Bay State Health and Caring Health Center. He received his undergrad degree from the University of Puerto Rico in industrial microbiology, as well as a medical degree from the University of Puerto Rico Medical School, and subsequently did residency in infectious diseases in tropical medicine fellowship at the University District Hospital in San Juan, Puerto Rico. That was a mouthful. Dr. Del Pilar Morales has lived in Massachusetts since 2014 and holds an assistant professor of medicine at the University of Massachusetts Medical School, as well as serves on commissions for the Board of Health in the city of Holyoke. Phoebe Walker is the Director of Community Service at the Franklin Regional Council of Government, involved in public health program design, evaluation, and implementation of Franklin County for over 25 years. Ms. Walker has worked on regional public health collaboration, substance use disorder prevention and intervention, chronic disease prevention, and a wide variety of municipal government policies and staffing issues. She was appointed by the governor to the Special Commissions on Local and Regional Public Health. She currently serves as a member of the Massachusetts COVID Vaccine Advisory Group. And then finally, we will have Lindsay Tucker joining us. She serves as the Associate Commissioner of the Massachusetts Department of Public Health, responsible for the department's bureaus of community health and prevention and family health and nutrition, and the Office of Problem Gambling. As Associate Commissioner, Tucker helps to oversee the agency's 3,000-member public health workforce and promote its mission to prevent illness, injury, and premature death. She ensures access to high-quality public health and healthcare services, and she also promotes wellness and health equity for all people in the Commonwealth. Tucker has over 15 years of experience leading healthcare reform efforts and working to eliminate health disparities and promote healthcare access and health equity. Phew, I got through them. So now we are going to turn the panel discussion over to Commissioner Helen Carlton Harris to give you a presentation, and then we will take some questions for the Commissioner. Thank you for joining us, Commissioner. We are so happy to have you today. You're still muted, Commissioner.
Good morning, Councilor Whitfield, and thank you so much for the invitation to both you and Richard Johnson, who are stalwart members of the Springfield community and great community activists. I am so pleased to be here. So thank you so much for the invitation. Thank you to the C3 family for inviting me here. I am pleased to try to give an update around COVID-19, the city of Springfield, and a little bit about vaccine. So this journey for me started March 6, 2020. March 6, I did my first press conference with the mayor and the city of Springfield to talk about a virus called COVID-19. At that time, at that press conference, there were 0 cases in the city of Springfield. So I was able to stand up at that press conference and say there are no cases in the city of Springfield. That same month, March 2020, the city had 54 cases. And so we have been on this journey for a year. It has been a journey that really has impacted every facet of life in our city and in our nation. And so we know that coronavirus is definitely a virus that is a respiratory virus. It is a virus that is spread through coughing, sneezing, laughing, singing. All of those things that we do are a mode of transportation for this virus. This virus really is something that has impacted our health physically, mentally, spiritually, and emotionally. And if you hear me talk about health, I talk about those 4 quadrants because I believe in order to be a healthy person, you must pay attention to your physical health. So with physical health, we pretty much know how this has impacted individuals' physical health, the hospitalizations, the deaths, what's happening to our neighbors in our community, our spiritual health. Our houses of worship have been shuttered. We haven't had the same level of contact that we've had through our families. And so our spiritual health has definitely been impacted, as well as our emotional health and our mental health. So those quadrants and this virus has left us all just really, really unbalanced around our lives. And we're seeing that in every facet of our life. The Springfield Department of Health and Human Services is a board of health. And as a board of health, it is our job to follow the regulations, policies, and procedures in order to keep a population healthy. There are 351 boards of health in the Commonwealth of Massachusetts, very much unlike the rest of the country. Most of the country does county health departments. We do separate health departments here in Massachusetts. So as a board of health, infectious diseases come to my department. And so our job is to take those infectious diseases, whether it's tuberculosis, other communicable diseases, but this one, COVID-19, certainly has been the one that has us all working overtime. So when a positive case comes in the city of Springfield, that case is given to us through a system called MAVEN, our infectious disease portal. It is our job to take that COVID-19 case, do the important work as far as notifying the individual is concerned, and then doing the contact tracing to make sure we're figuring out who that individual has been in contact with. So our job is very clear. Our job is to make sure we're notifying the residents if they're COVID positive. Our job is to follow up through contact tracing to see who that individual has been in contact with. In addition, we're responsible for going out and making sure all of these businesses are complying with the orders that are handed down through the governor's office. So we certainly can, we know that it's a big job. And I will tell you, I could probably spend a lot of time just talking about the work that we do. But this virus has had a disproportionate impact on the Black and Brown communities in the city of Springfield and in this nation. All human beings are at risk of infections, but there are several factors we consider when we think about Black and Brown individuals in our communities. We are more likely to have pre-existing conditions such as diabetes, high blood pressure, lung disease, obesity. So we have pre-existing conditions where we are disproportionately represented in most health status indices data that we see. So we have a history of health disparities. We live, many of us, in urban communities where we don't have the ability, because it's densely populated, sometimes social distancing, even within our own homes and our neighborhoods, is difficult. I also believe that the number one health status indices we need to pay attention to is definitely poverty. So when individuals are impoverished or lack access, then we know that the health disparities is going to be impacting. And so it's also important to acknowledge that while many of us can telework, we can work remotely. That's not true for many Black and Brown individuals who are essential workers in those grocery stores, working in government, working in the small bodegas and in the supply places that are giving us the necessary supplies that we need. The other factor is we're most likely to be without a car. And so we've got to take public transportation to get where we need to go. And so we are, as a community of individuals in our Black and Brown communities, the health disparities, many factors contribute to why what we're seeing across this nation is that we are disproportionately represented in COVID-19. This virus has pulled the Band-Aid off of health disparities and has put a mirror up to us and said, look, here is what the United States looked like, and here is how it is impacting us. And so I'm showing you a map of the city of Springfield. This map is from January 1 to February 13. So every red dot represents a COVID-19 case over the last 6 weeks. And so what you can see is 01108, 01109, 01104 have traditionally had the most cases, but I also should tell you that the population base in those neighborhoods are higher than many of the neighborhoods in the city of Springfield. So those are the cases that we are looking at right now as of February the 13th. If I went back all the way to last March 2020, this whole map would be red. And so we can move on to the next slide. This slide really helps you understand what I was just talking about, which is in March, we had those 54 cases. And then you can see in December, we had 4,496 cases. We did go down a bit in January, and for February, right now, we're at 1,677 cases. As far as the weeks are concerned, you can also see that our cases are dropping. I should say that the week prior to the 1,043, we had 1,177. And so for the last 4 weeks, we have seen a drop. 5 weeks actually. Last week, our cases went up 62. But I'll tell you that Sunday and Monday, I'm seeing cases right now that are 52, and 53. So our cases are dropping back down, but we definitely saw a slight uptick last week. And so the cases, the confirmed cases by zip code last week, you can see that. I just talked to you about that. 01104, 20%, 01108, 14%, 01109, 18%. And those are the neighborhoods that we watch very, very closely, because we know that there's a disproportionate impact in those neighborhoods. And we also know that those neighborhoods have a high concentration of individuals of color and individuals who are definitely marginalized. So what are we seeing? Under the age of 50, we have continued to see that under the age of 50 is where we're seeing our most cases. And 30 and under is 46% of the cases for last week. I am seeing some colleges. It's not overwhelming the system as far as positive cases are concerned, but we do have colleges that are contributing to the case rate that we're seeing currently. I should also say that we have 01109 has, as you know, AIC, Springfield College, as well as some portions of Western New England College. And so 3 colleges plus STCC Community College do reside in the 01109 zip code area. So in terms of this, this just looks at race and ethnicity from last week. Our cases, that unknown is where they don't pick up a race or an ethnicity because it's not there. Last week, we were 15%, Black, African American, Latinx 27%, and white was 30% of the cases. And again, this is just last week's cases. Thank you. Next slide for VaxForce. That will take me 2 minutes to do. Okay, so what are we doing as far as vaccines are concerned? The city of Springfield has administered almost 2,800 vaccines, because we have done our second doses for our first population. We will be standing up additional clinics. So VaxForce is a group that we have put together in the city for the citizens of Springfield. We want to use science, data, and information to guide decision making. VaxForce is not telling you to get vaccinated. We are simply wanting to give the information so people can make credible decisions. Next. So the mayor is the convener. I am the chair of the committee, and we have a strategy marketing team that we're working with to help keep us focused, and that's Axiom Blue. Thank you. The committee. So Elsie Sanchez is the chair of the Medical Reserve Corps. She's on the committee. Kathleen Zegda, Public Health Institute. Dr. Scavron, Brightwood Health Center. Jose Claudio, New North Citizens Council. Dr. Balder, Mason Square Health Center. Maria Ligas, New North Citizens Council. The mayor's chief of staff, Tom Ash. Ashley Bogle, who is the general counsel at Health New England. Damaris Jones, director of harm reduction for Tapestry Health. Dr. Sarah McAdoo, UMass Population Capstone. Denise Jordan, Springfield Housing Authority. Jeannie Clancy, Public Health Council and Public Schools. Yemisi Olorotola Coates, Chief Diversity Officer at Bay State. Melissa Madison, Department of Pharmacy. Dr. Madison is with Western New England University. Wesley Days, the Public Health Council, as well as UMass. Magdalena Esposa, who is the coordinator of infectious disease at Trinity Health, and Christina Hubner Torres, Vice President, Caring Health Center. So we have a really rich committee with a lot of wonderful individuals that we have stood up to help us as far as VaxForce is concerned. This committee has met 3 times. Next slide. And so the committee is broken out into different areas, and each member of the committee has taken the different areas. And I'm going to go through this quickly. So one of the committees is the healthcare clinicians. Their job is to share the information with the public around the medical portions of COVID-19 with the scientific facts. The research committee is looking at research and tracking the public's attitudes in Springfield and the experiences with vaccination. We're using a combination of surveys, focus group, and the survey will track the active nature of public opinion as vaccine distribution unfolds, including vaccine confidence and hesitancy. And we will have trusted members and messengers. Hopeful some of you will join us, as well as getting the public's experience around vaccination. That is the research committee. The operations committee is to develop best practices on designing a COVID-19 vaccination and distribution system that is easily accessible. We will be standing up clinics in neighborhood. I'm confident of that. The operations committee, as well as our staff, will help with operations. Individuals are anxious to volunteer. We did an excellent job at Bowling School in the vaccines that we gave out. Next slide. Education, they are identifying the intersection of COVID-19 vaccine distribution and institutions of higher learning, secondary education, youth organizations in the city. So we're looking at getting information from those individuals who live, work, and play in the city of Springfield to inform our work. Faith, really important for us. We have already, St. John's Congregational Church has already agreed to be a vaccine site for the city of Springfield Department of Health and Human Services. That's major because it's important that we stand up clinics where people are. And so we will be standing up clinics in houses of worship. St. John's is the first church that has said, you know, we're happy to work with you. You can stand up here. And so the faith community is very important to our efforts. Diversity, equity, and inclusion, really important. That's where you start to look at race, ethnicity, the impact as far as the data is concerned, and what are those messages we need to get out there to make sure that people in our communities are comfortable with the information that we are giving them as far as vaccine is concerned. So we're going to be developing vaccine resources for diverse groups in our cities, including materials, online engagement, and we'll be soliciting feedback to improve communication strategies. We know Springfield is diverse, we know the nation is diverse, and we need to make sure that our language is consistent with what individuals can hear as far as their race and ethnicity and experience, lived experience is concerned. So that's the Diversity, Equity, and Inclusion Committee. Thank you. And so I think I'll just end by simply saying that, you know, it's important that we stay connected with each other. VaxForce will be doing a town hall within the next 3 weeks. I don't have the definite date, but we will be doing a town hall. We look forward to each member of the VaxForce committee reporting out on their particular areas. I'll end with watch your distance, wash your hands, and wear your face coverings, please. We are not through this yet. We're going to get through this, but we're not there. So do what you know is going to be important to keep us all healthy and safe. I appreciate you, Councilor Whitfield, and my wonderful friend, Richard Johnson, and the C3 team. Thank you for the invitation.
Thank you so much, Commissioner Carlton Harris. That was a fantastic presentation. We didn't get any questions for you, I think, because you were so thorough, but the screen up tells you all how to ask your questions. Please raise your hand if you want to speak. Ask it in the chat, and if we have time, we will ask the questions, but we definitely appreciate the commissioner and her thoroughness on what's going on in the city of Springfield. And if you have questions that you think about later, please email us at the email that Nicole has placed in the chat. And we do want to keep the panelists moving. So we will move right along to Dr. Morales del Pilar.
Okay, can you guys hear me okay?
Yes.
Okay, so I'm gonna be sharing my screen. And let's see. Can everyone already see this?
Not yet.
Okay. Let's see. Share screen. One. Okay, here we go. There we go. Can everybody see this now? Okay, good. So we're gonna, my job today is to basically give everyone a little bit of a sense of what the vaccine is, where it came from. And I did receive a few questions, and when I looked at the list of questions, it was something that I commonly see in my own patients. So it's something fairly universal. So I'll try to answer them as best as I can as we move forward. I think that one of the first questions is, didn't we get this vaccine a little bit too quick? And the answer is not really, yes, it moved a little bit quicker than you would see your traditional vaccine, but we already had a baseline of what to do and where to look for, because in 2002, we started seeing this virus called SARS that is in the same family as COVID. And as you can see from the map, it started more or less similar to COVID. They started around China and then kind of just spread everywhere. We had very few cases here in the US, and they were all from travelers. A few years later in 2012, we had this other virus called MERS-CoV, which is again in the same family as the virus that gives you COVID. This was mostly in the Arabic Peninsula, and we had a few cases in Europe, and we had one traveler that actually came to the US. So during both of these viral outbreaks, we started looking into vaccines to kind of hold them, thinking that it could have become something similar to what we saw with the COVID. Thankfully, both of these viruses died off on their own and research stopped, but we already had all the information, and we have that bank of knowledge of the vaccine trials that were already underway for these particular viruses. So when the COVID virus came along, which is, as you can see right here, we looked at the genetic component of all the virus, and we compared it to the MERS-CoV and to SARS. And we see, if you look at it just by looking at the picture, you can see that they're almost identical. It's only in these little areas over here that we can see that that's what makes the virus different and why it gives you different disease and behaves a little bit different. So we knew that we could use the information from these previous vaccine trials to extrapolate it and basically use it for this new vaccine. So we really, as you can see, there were more than a few trials being done for both of these viruses. But again, since the virus basically disappeared on its own, they never basically went beyond a phase 2. So what we did with the COVID vaccine was that we basically took all that information and basically used it as a trampoline to kind of move forward and get the information and the work going. Obviously, it helped that not just the federal government, but the European Union, several nations throughout Asia and Africa, they put up a lot of money to make sure that the research move forward really quick, because a lot of times what can hamper a vaccine production is, do you have the resources? So that wasn't really a big issue with COVID vaccine. Now, if you look at the vaccines that we have right now, we have 2 approved under an Emergency Authorization Act, and they are the Pfizer and the Moderna. They're both RNase vaccine, and I'm going to explain to you what exactly that means. And they both completed phase 3 trials. That means that they were given to a lot of people and they were shown to be safe. And because of that information, the FDA said, okay, we can start giving it out to the general population. We're still gathering a lot of information because, we like to have bigger numbers to make sure that any medication or vaccine works. So even as we vaccinate more people in the community, we're still gathering all this information to make sure that, yes, the vaccine is safe, and yes, it does what we think it does. So this is basically a science class. Imagine you're in 5th grade and this is what your science teacher is teaching you. We all have DNA in our cells, but the way that this DNA basically becomes useful information for your cell to work is that it creates this thing that we call mRNA, or messenger RNA. And that's like your computer sending an email so someone can build something for you. And that's basically what we're doing with this vaccine. My nephew sent me this little cartoon, and I found it so straightforward and useful because it's a very good, simple explanation of how the vaccine works. Typically, these little things in your cells called the ribosomes, they'll take the RNA that your DNA sends and create proteins and creates all the stuff that your body needs to kind of work and function. What we're doing is that we basically send this little messenger RNA, and the ribosome says, well, this is another message from the nucleus. So it actually produces the protein that we want it for and creates the antibody subsequently that your body's going to need. So to be more specific, what we're looking in the vaccines is that, as you remember from the slide a few slides ago, all the viruses in this family, this spike protein is almost identical. So we saw this is a very good place for us to create antibodies to protect our patients. So we basically took the genetic material that basically makes that protein, and we created the little email that we're gonna send into your cells. And then we code it in lipid so it actually can get into your cell well enough. And that's basically is what's in the vaccine. So when we inject you the vaccine, what happens is that lipid basically is like a key, so the messenger RNA can get into your cell. And when it's in your cell starts producing all these little spike proteins that are identical to the one that you see in the virus. And once your immune system sees that, you start creating a response to it, you create antibodies. So we're basically using the machinery that your own cells have to create the protein that you're eventually going to create an immune system response for. This is a very novel way to do vaccines. This is the first one that we've actually used in humans, but the technology has been around for a few decades. It's just that it wasn't ready for prime time, but a pandemic can make things go a little bit faster than we would like. So if you look at the studies themselves, this is a slide that our own DPH provides. You'll see that for the Pfizer vaccine, we had over 40,000 people enrolled in the phase 3 trials, and they were looking at people that are younger than 16. Now, if you look, it's almost half and half for male and females. But when you look at the distribution by race, you see that most of them are white, quite a few Hispanics, and more than a few Black/African-American patients. The reason that we had a little bit more of the Latinx community in here is that a lot of the trials were being done in South America, so we were able to capture the population. If you look at the Moderna vaccine, it looks almost more or less similar. They had about 10,000 people less, but still 30,000 people. That's quite a few people. And if you look at the distribution, it's almost similar. That it's mostly white with a tapering off of Latinx and Black patients. Again, given the nature where they were doing these studies, it kind of skews. And this is something that in medicine we know is an issue, that my people, Latinx, and other people of color are usually underrepresented on these studies. And it's something that we're kind of working toward to kind of fix. But there was representation of almost every ethnicity in these cultures, and throughout all ethnicities and races, we saw that the vaccine was tolerated essentially the same, whether you were white, Latinx, Black, Asian American, Indian American, or other. Now, another common question we get is, what do I get if I get the COVID vaccine? Well, first off, as you saw, we're giving you just an email, a messenger RNA. So the vaccine can't give you the COVID. There's no way that the vaccine is going to give you the COVID. But your immune system will respond to it. So the most common thing that you get is, like with any vaccine, you might get a little bit of swelling and discomfort where we put the vaccine. And you might get fever, chills. You'll feel a little bit tired. We've seen in some of our patients that those that have issues with migraine headaches, that might trigger a migraine headache. Thankfully, these are fairly rare. Most patients will complain that, yes, where they gave me the vaccine, it's a bit sore, and it might limit what I do with that arm for the next day or so. A lot of people will feel about the tiredness, but the fever and the chills, a little bit less common, but common enough that we feel the need to kind of inform people. Most of the time, if you just put a little bit of a cold washcloth over the area, as directed by your physician, maybe something like Tylenol, ibuprofen, that might help as well. And obviously important the drink fluids as well as as much as you can, obviously under the guidance of your doctor. It's been our experience that most of these symptoms only last about a day, maybe two. And then the next day, you feel much better. That's been my personal experience where I got the vaccine, and that's been the experience of many of our patients here in Bay State. A lot of people ask, why do I get a worse reaction with the second shot versus the first shot? And the reason for that is that, well, the first shot, your body is seeing this for the first time, so they're building up some antibodies. With the second shot, your immune system remembers, and now the reaction and creating antibodies is much more robust, so the reactions tend to be a little bit more severe. So I've had patients that said, with my first shot, I didn't have anything, and with my second shot, oh dear God, I felt super tired. I had to stay in bed all day, but usually the day after, they're feeling quite well. So that's why the second shot tends to be a little bit harsher. But then again, you might be like a good friend of mine that shares my office here in the hospital, that with the first shot, he felt kind of crummy, but with the second shot, he didn't have anything. So it's very variable from person to person. Now, this is something that the CDC encourages people. This is an app and a website, is the V-Safe, that if you have taken the vaccine and you get any symptomatology whatsoever, we want to know. Because if we don't know that the patients are experiencing one symptom or another, we can't tell people to look out for it or to do anything to prevent it. Vaccine sites, and at least here in Bay State, for our patients, when they call us, we actually put information directly into the system, but the patients can do it directly too. So the websites are here, and if you go to the Massachusetts Department of Health webpage or the CDC webpage, this is right front and center, so it's easy enough to find. So another question that we typically get, so I got the vaccine now, so how long do I need to wait until it's actually like full force and effective? Well, you'll start to see some antibodies about 2 or 3 days after you get it, but typically you don't see the full effect or the full benefit of the vaccine until about 2 weeks after you get your second shot. And for those of us that work in medicine, that it's kind of understood, because that's more or less the time frame that your body needs to build up all these antibodies. Remember, you're creating these antibodies from nothing, so your body needs a little bit of time to kind of gather all the resources and create them. So although you're going to have some antibodies a few days after the shot, you won't see the full-blown benefit until 10 to 14 days after your second shot. Another question that we get a lot is, well, I got my shot, so do I need to follow, quote unquote, the rules? And meaning, do I need to wear masks? Do I need to social distance? Do I need to do anything else? And the answer is, yeah. We do think that the vaccine prevents transmission, and I think that as early as yesterday evening, there was some data to support that the vaccine seems to probably stop transmission, but we don't know for sure. So until we know, we still need to go under the presumption and be on the safer side that, well, I got the vaccine, I'm probably okay, but I don't want to put my mother that's 95 years old at risk. I don't want to put my neighbor that had a kidney transplant at risk, and we just be overly safe. Although there's a small chance, you could still get COVID-19 even if you had the vaccine. If you look at the studies, you'll see that 95% of the people with the Pfizer and the Moderna vaccine didn't get COVID at all. But there's still that 5% of people that got it. The good thing is that even if you get it, you probably won't get that sick. Most patients had very minor symptoms, if they have any symptoms at all, and none of them ended up in the hospital and none of them died. So some people argue, well, if I'm going to get COVID anyway, why should I get the vaccine? Well, because if you get the vaccine and you end up in that small percentage that you actually get it, you're still safe enough that you're not going to end up in the hospital and you probably won't die from it. So what happens to kids and pregnant women? This is a question that we get constantly. Now, the Pfizer vaccine was tested in 16-year-old teenagers and older. The Moderna was only tested on 18 years and older. There were no real pregnant patients that were deliberately put into these studies. The reason that we do that is that there are a lot of ethical questions when you're doing trials in children and pregnant women. So you want to make sure it's okay and safe before you jump into those groups. So right now, there are studies that are enrolling children as young as 12, and there are plans to, under take younger children in the next couple of months, but that's still ongoing. The thought process is that it should be safe because of how the vaccine works, but we don't have enough data for us to say, yeah, it's completely safe, we should give it. So that is something that's in the works. It's still cooking. Hopefully in the next few months, we'll have more data. We don't have a whole lot of data in pregnancy. We do have some animal models that show that there were no issues in animals. And we do have some experience with our healthcare workers that are pregnant that have gotten the vaccine, and it seems to be safe. You know, I can tell you that one of our coworkers here, that she actually works in Mesa Square, Dr. Amanda Westlake, she's pregnant and she got the vaccine and she's fully fine. But until we have more data on a larger group of pregnant women, we can't say for sure, oh yeah, go ahead and get it. It's something that, you know, the doctor and the patient should have a conversation. And, you know, if you're otherwise healthy, you're fairly well along in your pregnancy, it's something that you should consider, because pregnant patients are one of those groups that can actually have a worse outcome if they get COVID. So more to come on this, but it's things that we are seeing, things we're looking at, and hopefully in the next few weeks, few months, we'll have more information to provide a more robust recommendation regarding this. Now, another thing that we've seen a lot and heard about it on the news is this concept of herd immunity. So what is herd immunity? So it's basically that if you have enough people in your population that can't spread a disease, you basically halt the disease. So in this first diagram, this is where we were March of last year. Nobody had immunity because nobody knew about COVID-19. So one person spread it to one, and they'll spread it all over the place, so a whole bunch of people get it. Now, when you move along and you have people that, let's say, got COVID-19 and recover, or you're vaccinating, you can see that you can still spread it a little, but because these people are immune to it and can't spread it, you halt the transmission. And obviously, if you have a whole bunch of people that are immunized or can't transmit the infection, you stop it altogether. So I like this little diagram because it shows you where this idea is coming from. And you'll see that if you're not vaccinated, it spreads really quick. And as you increase the percentage of people that are immune through vaccination, you can see that it slows down very much to the point where you have over 75% of vaccination that it's so manageable that with contact tracing, you can stop it. So some people have asked, well, why don't we let this just happen naturally? Let everyone get COVID-19 and be done with it. Well, let's look at the numbers. Right now, the last estimates of the US population is about 330 million. And if we need about 75% of people with herd immunity, that means that we need to make sure that about 248 million of Americans get COVID or get vaccinated. So if we look at how many people that get COVID died, that has changed a lot throughout the pandemic. At the beginning, it was really high, it was almost 3.5%. But as we've gotten better and got more information, we treat it better, so it has dropped down. It's still pretty high. So the last estimate is that around 1.8% or about 2% of people that get COVID might die from it. So that means that about 4.5 million people would have to die for us to get herd immunity through natural infection. So this is why every single doctor that's worth their degree, it tells you that this is not something that we should be looking at, and that the way that we should be doing this is through vaccination. So that's why we didn't like herd immunity at the beginning of this, because it would have been that, oh, let everyone get infected and whoever survives, good, you survive, now you're immune. But obviously we would have had a very large loss of life because of that. But with vaccine, that's what we want. We were going to create this in a safe way that doesn't cost any lives. So herd immunity in the sense of a vaccine is good. Herd immunity in a sense of natural infection, no bueno.
Thank you.
So as a summary, I'm just going to leave this up there so you can guys read it. But, you know, the vaccines are safe. We still recommend that you wear a mask and social distance. The vaccine is probably safe in children and pregnant women, but we're getting more data. And there's a small chance you can get COVID even after vaccine, but you should not get sick or you should not die. At least that's what the study shows us. That's about it.
Thank you. That was a lot of information. And it was great information because it answered a lot of the questions that we got ahead of time. But we did get one question for you, Dr. Del Pilar. How has the vaccine affected people that have asthma? Is there any studies or data on that?
So it's a fairly common question that we get. I'm asthmatic, I have COPD, should I get the vaccine? And the answer is yes, you should. You're actually groups at high risk for actually getting complications. We have vaccinated a lot of people, and among the people that were in the studies, there was a large group that had pulmonary lung problems. And they did just as well as the people that didn't have any lung problems. So you should get it. It's safe in people with asthma. I think that a lot of people have that question in their minds because they say, well, if I have allergies, that makes my asthma bad. And they said that if I have allergies, the COVID vaccine might be an issue. So we're talking about two different things, because it's one thing having environmental allergies and one thing having allergy to medications. So our patients with asthma, at least, again, we've in the hospital employees, we vaccinated over 9,000 people, and a lot of them with asthma, and we really haven't seen any thing that would make us pause that, oh, you shouldn't get it. On the contrary, please get it.
Thank you. And that's the same answer for kids with asthma?
With kids with asthma, it's probably the same answer, depending on how young the kid is. And that answer might change, because if we have someone that's younger than 16, we don't have yet the robust data for us to say, oh yeah, let's vaccinate someone younger than 16. But again, those studies are ongoing, and hopefully in the next couple of months, we'll have some answers for that.
Perfect. And then I have one final question for you, doctor. I've heard a lot of times people say, well, I'm protected. I had COVID, so now I have the antibodies in my system. I don't have to worry about anything. I don't need the vaccination. Is that true? And how long does the antibody last? Does it last forever?
So that statement is half true. What we've seen is that if you get COVID, you will develop antibodies and you will be protected. The thing is that what we've seen is that those that get very mild infection, or those people that didn't have any symptoms at all, the antibody levels drop so fast after 3 months that we can't guarantee that you're safe. So that's why we say that even if you got a COVID, you should still get the vaccine to make sure that those antibody levels are as high as we can get them to stay protected. Because with the information that we have so far, the only thing that we can say is that if you have COVID, you should be okay for the next 3 months, 90 days. But after that,
okay. Well, I thought that was going to be the last question, but here's the real last question. Are there any assumptions, I know there's no data yet, about possible long-term effects of the vaccine? I believe there was some data about long-term effects showing up from people who've had COVID, showing up years down the line.
so it's a little bit different when we talk about COVID infection and what happens after that versus the vaccine. Because we have seen that people that get COVID and recover, they have this overreaction of the immune system, that their symptoms can last weeks, sometimes even months. We really haven't seen that with the vaccine. Usually the inflammatory process that we see, that basically what gives you the fever, the chills, the pain in the where you got the shot, usually subsides after 24, 48 hours. The information that we have so far doesn't seem to indicate that there is going to be any lasting effect, at least adverse effects from the vaccine itself. Some people say, well, is this going to change my DNA? And the answer is no. The way that your body handles this email, as I referred to it early in the presentation, is that your body will actually degrade and eat that up and destroy it after a short time, because that's not supposed to be floating around, and your body doesn't allow for that. And that doesn't get integrated into your cells because we don't have the appropriate mechanisms or enzymes for that to happen. So after you get the vaccine and you develop the proteins and develop the antibodies, that's where the vaccine basically ends. Now your immune system takes over and just keeps up the production of antibodies. I'm hoping that answered the question.
I mean, it answered it for me, but I don't know if everybody else got it. But we do need to move on. And we are just very grateful that we have been now joined by the Associate Commissioner of the Massachusetts Department of Public Health. She's not up next for the panelists but we just want to welcome her and thank you for taking your time to join us. If you just want to say hi, wave so folks can see you.
Thank you so much for having me. I'm very happy to be here.
Thank you so much. And so we'll have some words from Phoebe Walker, who is the Director of Community Service for Franklin Regional Council of Government. And I did do everybody's bio before, so I won't do it again, so that we have time to get to Ms. Tucker, and then we will hear some testimony from people in our community.
Thank you so much, Counselor. Brendan has my slides, I think. So I'm here just really as a member of the state's vaccine advisory group. And I'll talk a little bit more about that, but I thought I would just start with sort of who has gotten the vaccine so far. So we have about 6.9 million people in Massachusetts. 5.4 million of them are over 18. So right now qualify easily for the vaccine. We've had about 1.5 million doses shipped to Massachusetts and about 1.2 million doses given. So I think it's always important to start with to mention that, because I think we all wish that there was more vaccine. We all really urgently wish there was more vaccine, and it's picking up speed, but there are a lot of people who still obviously have not been vaccinated. So far, 58,000 doses have been shipped to Hampden County. So that means that that's how many have come to the healthcare providers or vaccine providers of any kind in Hampden County. And then the state has a wonderful report that comes out regularly telling you what's been happening in terms of vaccine administration, which I just put in the little chat if anybody wants to see. So that's where we are. You can go on to the next slide. This, I hope, looks familiar to everybody. This is a schematic of the 3 phases of vaccine. And we go bullet by bullet through these phases. So everybody remembers phase 1, when healthcare workers and first responders were getting it. We are now in the 2nd bullet of phase 2. So everybody 65 and over, and anybody of any age over 16 and over who has 2 or more specific health conditions that are listed on the state website is now eligible. The next time we move on, it will be this huge batch of people in the early education, K-12, grocery, utility, food, et cetera, essential worker category. There are about 1 million people in the bullet we're in right now. And then the hope is that by somewhere between April and June, we are getting to phase 3, which is absolutely everybody. You can go to the next slide. Thank you. So this slide might be slightly misleadingly labeled, but there is a state advisory group, vaccine advisory group. This is the list of the people who are on it. We're meeting from about September on, trying to come up with a list of who should get it in what order in Massachusetts. And I'm with you here today because I'm the only person from Western Mass on that advisory group. And I'm also the only person from a local public health department. And as the commissioner spoke earlier, the local health departments have an important role to play in infectious disease prevention and vaccine in general in Massachusetts. So it's been a real honor to be on this committee. There's a lot of really interesting, smart people, and we spent a lot of time thinking through what was right for Massachusetts. If you could go to the next slide, that would be good. And these were the things we were thinking about. How do we keep our healthcare system running so that it's ready for spikes that come? And how do we limit severe sickness and death? And how do we really put equity front and center? So one of the principles we operated under was that the point of the vaccine is to prevent death. And that is why a lot of the lists in those 3 phases, that's why a lot of those things are in places you might not expect to see them. And I think there's been a lot of concern and questions about why is this category of person or that category of person not higher up? And we really took very seriously our charge to think about who is at risk of dying. We don't want to lose one more Massachusetts person if we can help it. And so when an entity is a kind of person is not as high up in the list as you would hope, it is in terms of the list we created, it's because while they may be at risk, they actually have the tools to keep safe, or they are not shown to actually be more likely to die. I'm sorry to even talk about it in this concrete, like this way, but there's very hard conversations to have, and we took it very seriously. We looked at a lot of data about who is getting sick, where and when, and we thought a lot about how to make sure that more vaccine is going to communities that are inequitably impacted by COVID, like Springfield. So that was front and center a goal for us. We came up with a list. That list is, we are the advisory group, I want to note. The governor and the command center have made some changes to that list. We had the essential workers above the 65-year-olds, and that is a change that came out of the command center. So just to be clear, we aren't the buck does not stop with us. And then we continue to meet. We met last night for a number of hours talking about the Johnson & Johnson vaccine that is coming. So there will soon be a third vaccine. And also talking about the list of health conditions, which I'm sure is something everybody has heard a lot of questions about, which health conditions are on that list and why. And so we gave a lot of time to think what kind of data is coming out about different health conditions. Should we do that data as it shows up? Next slide. This is just one I wanted to make sure, this is my last slide. I want to make sure it's just very clear that there is no reason that a person would need to prove anything about their immigration status or even have a valid driver's license or have any form of identification. We wanted to make sure that there is no barrier whatsoever to getting the vaccine for people. And I think that is it for my slides. So I'm always happy to hear from anybody with any questions or suggestions for how the vaccine advisory group could work better or take more, more input from people. So thank you very much for having me.
Thank you, Phoebe. We appreciate that. I do have a question about the list that you mentioned and the order. Are they in that link that you provided?
I will put another one in. I will put a better link in about the list in order. And there is a very nice place on the website where you can find out exactly where you are in that category. So I will do that as soon as I've turned my mic back off.
All right, that is perfect. Because I don't know all the infectious diseases not infectious diseases. We don't want all of those. We don't want a lot of those. I don't know all of the conditions that would bump people up to get the vaccine. So that would be very helpful.
Understood. Yes. And I want to clarify one thing. There is a list in the essential worker of the other worker list. That is not at this point intended to be in priority order. The assumption is that when we go to the next bullet, again, all of this is pending approval. The governor is in charge of how this all rolls out. But our intention is that next bullet is one group of people. So not that it would go through it in order, like, K to 12 and then grocery and then utility and then whatever. It's supposed to be one batch. Just like right now, it's anybody 65 and over or anybody of any age with 2 or more conditions. But yes, I'll put links to both of those in the chat.
Perfect. That's very helpful. And I believe our next panelist, Ms. Tucker, will be able to even expound even more on some of the questions that we have on distribution. How are we getting it to the vaccination centers? Why is there only one vaccination center in Springfield that's for the region? Are we going to expand that? I know the city council has written a letter to the governor asking that we control our vaccination centers because we have a great commissioner of public health in the city of Springfield who has managed very well the testing locations. And so maybe you can answer some of those questions for us so we can make sure that all of our neighborhoods, especially those in the Black and brown community that has been impacted the most in the area, can make sure we get vaccinated fairly quickly, if folks want to.
Great.
I'm not sure, Ms. Tucker, I'm sorry to interrupt, but I don't know if you have screens that you want to share. We can give you that capability as well.
Thank you. I do have some slides and I think I can share them. And my slides, Phoebe, overlap with yours, so I will go through those more quickly. But first of all, just thank you again so much for having me here. I really appreciate the opportunity to connect with you and really, really value the invite. So thank you again. I do have a bit of an overview and then can get to some of the specific questions that you sent me as well. This was one of Phoebe's slides, so I will go through it quickly. I do want to flag that on the state website, there is a lot of information that is available to you. I imagine some of it has been talked about. It sounds like Phoebe's going to put a couple more links in the chat so that you can continue to find information, but wanted to flag that in addition to information about eligibility, there's also a lot of information online about where to get vaccinated. And I know that that is exactly part of what you are focusing on today. So part of that is online, and here you can see sites, and many of them are concentrated in my neck of the woods as opposed to your neck of the woods. And that again is part of what you wanted to talk about today. But just flagging that this information is online and is updated regularly as we are continuing to shift and add where sites are. I think the doctor who was speaking when I joined talked about a lot of this, so I won't continue, but I will share the slides with you, and you can post them or send them out to the extent that they are of interest. But certainly defer to your clinical leadership on this. But we do have information for you to use for yourselves and in your communities around vaccine safety and efficacy, and we do have these flyers and materials available in about 10 different languages, and are happy to translate further if there is a need. So really wanting for this to be as accessible as possible. And we are also working on some plainer language, more simple information for folks who, for whom that will be helpful. I also just wanted to flag our relatively new communications campaign, Trust the Facts, Get the Vax. It is backed by lots of research, both nationally and here in the Commonwealth. We worked with a number of community-based organizations to pilot some messages and make sure that what the framework was making sense and working for folks. It relies on some trusted messengers and is multilingual, and we do have multiple different ways of getting the information. So there's information you can read, there are some videos you can watch, there's audio and radio, and so trying to get information out in multiple different ways, again, in multiple languages. And this will be running through June at minimum. I imagine we will continue it after that. But just wanted to flag this for you. And all of this is on the website, including the links to some of the clinical folks talking about the vaccine, again, in multiple languages. We are also collecting people's stories about getting vaccinated and really wanting to share that. The best messenger for many people is someone that they know and trust. And so the more that we can help share these messages of people choosing to get the vaccine and their experience with it, we hope that will be helpful as well. The final thing before I turn to the questions that were asked of me is that we also online have information about hosting a forum, which is what you are doing today. And if you want to continue to do that in other settings, we do have a slide deck that you can use that includes a lot of the information that I am talking about, as well as just some basics on vaccine safety and efficacy. So just slides available for you for your information and use if you would like. And Phoebe, you and I were thinking the same thing here. We both pulled up some of this information. So really wanting to flag this. Oh, and I duplicated the same thing. So sorry that I cut and paste that twice, but that is on our slide. Very, very important. I did want to flag an announcement that the administration made last week, in particular, because I think it speaks, Councillor, to some of your questions around prioritizing communities that have been disproportionately impacted by COVID and that have historically and currently are under-resourced and underserved in the COVID effort. And Springfield is one of the 20. And we are really thrilled to be rolling this out this week. We are just starting yesterday. February 22nd was the first day. Each of these 20 municipalities has a dedicated DPH community liaison. Commissioner, I believe you may have had the opportunity to connect with Commissioner Burrell, and also, if you haven't yet, you will shortly with your very own Liz Cox, who is a DPH staff person and also a Springfield resident, who will be the community liaison for Springfield. And I believe she is listening on this webinar today, but really wanting to collaborate with you, meet you, hopefully to the best that we can, meet your needs in terms of outreach and engagement. And this will include specifics around materials, as well as putting individuals into the community if it is helpful to you, for some canvassing and for some information, and more to come on that later this week. But just wanted to flag that we are very much understanding that communities and municipalities are very heterogeneous and needing different things at different times as the vaccine campaign rolls out, and so wanting to support you in that. The questions that you had asked specifically, so one is DPH tracking statistics of people that contact COVID or COVID-related deaths, and the answer is yes. We have an interactive dashboard. I put the link there in the PowerPoint, and it includes counts and percent of cases, hospitalizations, and death by age, sex, as well as race, ethnicity. So that is updated daily, and there is also a weekly dashboard that has additional information by geography. So that is online and available, and happy to answer questions about that offline as well. So how are the vaccines distributed to each state? The vaccines are coming from the federal government, and it is based by population. So Massachusetts gets vaccines on a weekly basis from the federal government based on our population size. And we get a distribution of both Pfizer and Moderna, again, based on our population size. If the new J&J vaccine, if and when that is approved, we will expect also to get an allocation from the federal government based on the size of Massachusetts population. And so how does it determine in terms of the different cities and towns? The Baker-Polito administration is working to make sure that we do have a distribution across the Commonwealth, really looking at a number of ways to get vaccine out. And also looking at the phasing that Phoebe talked through. So initial phase 1 was really focused on hospitals and healthcare workers, long-term care communities, nursing homes, and both individuals and staff. And so a lot of the vaccine really flowed into those hospital systems, and also directly from the federal government into our long-term care facilities and our skilled nursing facilities, and that was part of a federal partnership. In terms of CVS and Walgreens, that also, there is a federal retail pharmacy partnership, and there are streams of the vaccine coming from the feds to retail pharmacies, and the command center does request and make recommendations, for example, to CVS about which sites those go into, and we very much are looking to prioritize communities that are currently and historically underserved with vaccine, and so prioritizing these new 20 municipalities that I mentioned on the previous slide. we are very much wanting to work with you and other municipalities like Springfield to support you in vaccine awareness and vaccine access. And so working to make sure moving forward that you do have appropriate access to vaccine in a way that works for you and for your community. We know that the mass vaccination sites work for a lot of people, and for others they don't, either due to transportation or comfort level or times of the day that they can go get a vaccine. There's a whole bunch of reasons that we appreciate someone may or may not be able to get to a mass vac site, and that perhaps working with a local community health center or the local board of health or perhaps a mobile option in the future might be a really good way to reach a neighborhood or a particular senior housing space. And so we will very much be working with you and with all of you, your community stakeholders, to think about how we can best support you in vaccine access. And the last question, I will, it may have been covered right before I got on in terms of vaccine for kids. Yes, I'm seeing a nod from Dr. de Pilar, but that is still being tested on youth, and as soon as we have those results, which will still many months away, but we are, I think, all collectively very much looking forward to being able to vaccinate children when that is safe and effective. So just coming back to our website as a resource for you, and a huge thank you for inviting me here. These are different ways that you can connect with DPH and get more information. So conscious that I may have gone over time, I will stop now and see if there are additional questions. And I will stop sharing my screen.
Thank you very much. That was great information that you shared with us. We do have a question from one of our panelists, Richard Johnson.
Thank you so much to all of the panelists so far. Ms. Tucker, quick question for you with regard to access and equity. Understanding that the eligible persons who are eligible for the vaccine, the different tiers are changing rapidly. And I'm thinking about the digital divide and the system set up to schedule your vaccination, and the realities that when people go onto the system, all of the slots are usually taken. And considering the digital divide within our communities and access to high-speed internet and all of these considerations, does the department have any plans to address some of those inadvertent barriers for folks within our communities?
Thank you so much. Mr. Johnson, I don't know if your correct title is counselor or something else, so I apologize if I got it wrong, but thank you for your question. It's a really critical one. We know that the digital divide impacts people all across the state, and often in the Berkshires and in more rural places in different ways. So a couple of different things. The first thing is that there is now a call line that is available initially for individuals 75 and over who needed assistance booking appointments. It is open for folks who are currently eligible 65 and older and who do need assistance, who cannot use, who do not have access to technology or the internet, or who need help. So there is that phone line. The other thing that we can work with you on as this new initiative moves forward, and we will be working with Liz and with you, is you could, for example, plan clinics in the future and hold slots rather than put them online for anybody to access, but then have a local community-based organization or faith-based organization work directly with individuals to sign them up. And so there wouldn't be kind of an online race to get those slots filled, but rather slots held for a particular community or community organization that they could then work with particular individuals and families to help people who are eligible based on their age and their health status or their worker category to sign up. So we are working on some options like that, where we can work with you directly, work with your community groups, Commissioner Carlton Harris, work with you to plan in advance so that we can block those clinic times out and dedicate particular days or afternoons to particular groups.
Thank you. I have another question that I wanted to ask, and then I have one in the chat, and then we are gonna probably move on to some testimony. But the one question that I have is, you know, we got one center for the majority of the population in the city of Springfield, and the location of where it's at requires transportation, and you know that transportation is also an issue in some of the lower income communities of color. And I wanted to know if that was thought of. And also, as a city councilor, I have gotten a lot of calls on the wait time that people had to wait out in the cold just to get their appointment. And so I just want to say, I think this is more of a comment to take back, that when these planning sessions are taking place, we definitely need a representative from the third largest city in the city of, I mean, the third largest city in the city of, in the state of Mass, I don't know where we're at, in the state of Massachusetts, to be at the head of the table. Commissioner Carlton Harris has done a fabulous job making sure that testing locations throughout the community are feasible in each location so people can actually get to them. And I think that no one's going to represent the city of Springfield better than someone from the city of Springfield. So I just wanted to put that out there for you. And then also the question is, do you have it, Nicole? The question was, when will more appointments be available? Because the Eastville Mall location, and this is coming from a librarian that Commissioner Carlton Harris, she set up a system where the libraries will help residents book appointments, and the librarian is saying that the appointments are full, and so they have people on the waiting list waiting for appointments to become available, saying they're going to call folks back, and there's never appointments available because of the region. We don't have enough locations in the region, and so she wants to know, when will more appointments be available?
Thank you. I will answer that last piece first, which is that I believe every Thursday is when new appointments at the mass vaccination sites are released. And so, and we know that they fill up pretty quickly, usually within 24 to 36 hours. So Thursday, today is only Tuesday. So 2 days from now will be the day to look for those new appointments at Eastfield Mall. I believe that some of the retail pharmacy sites may have new appointments starting Wednesday. But there is kind of a weekly cadence as we understand the doses that we're getting from the federal government each week. And so there's a weekly cadence for getting those out. Regarding transportation, it is obviously hugely important point, a massive component of the social determinants of health to be able to get where you need to go to have your health needs met. We have been working with our sister agency at Mass Health, and a recent change that was announced last week for Mass Health patients is a much more streamlined way to get transportation to and from a vaccine appointment. So that certainly doesn't help everybody, but for those who are Mass Health patients and clients, that is one way. We are also exploring different other transportation options. But I hear you. There are a couple different points that you had raised. One was the lack of appointments and the lack of available quick access to appointments, transportation, but then really where the vaccines are, and that even if transportation were available to everybody, still the Eastfield Mall is only one site, and Springfield needing just some variety so that different folks can access in different ways. So I absolutely hear you, and I do think in the coming days and weeks, as we ramp up this outreach effort and can coordinate with you a little bit more, and as hopefully more supply becomes available with the vaccine itself, we will be able to meet the needs much better. So thank you so much for raising all of these really, really critical points.
Thank you so much, Ms. Tucker. We definitely appreciate your time. I know you're busy. I know a lot of people are tugging at you for these same type of answers. I cannot stress enough that we need someone local in Springfield to work directly with DPH and with the governor I just want to keep stressing that because we have done a great job with our testing sites. So please, if that can be done, let's get someone from right here. And I know you said Liz Cox is from here, so that's great as well. So thank you, Liz, for doing that. Now, we don't have a lot of time left, but we do want to hear some testimonies from some of our community members that's well known in the community. And I'm going to start with ladies first and go with Michelle Roberson for a quick 2-minute testimony on her experience with COVID and why she chose to get the vaccine and how she's been affected by it.
Good morning. Good afternoon, everyone. Thank you for
Good
my
afternoon.
invite. Thank you for my invite. I did receive both my shots in January. I did have some side effects. I took my shot because I have an elderly mother. She's 81, and she does watch one of my grandkids that I have custody of, and I needed to make sure I didn't affect her because I am a community health worker and a care coordinator at Mason Square, and we did go out into the community. We do have few people coming into the clinic, but I didn't want to be the cause of my mother to get sick. So I felt that that's what I needed to do. And I also talked my mother into it. So she had her one shot and she's going to be having her second shot here at Mason Square on Saturday. We do shots for our patients here. And she had no side effects as of yet for her first one. She had the, I had the Moderna and she had the Pfizer. So I have been talking to people that I talked to on the phone when I called and try to advise more of the Black community to get the shots. I've been seeing a lot of Hispanics here at this on Saturdays, but not so many of the Black. So I have been trying to reach out to them as well.
Thank you, Michelle, and that's definitely appreciated. Can you just briefly tell us some of the side effects you experienced?
You know, I didn't know at first what I was gonna get because they didn't tell us. Well, I didn't listen at one or the other. I got headache. I didn't get it till like later. So I took my shot like 9 in the morning. I didn't get any effects until like 3 o'clock in the morning that night. And I got a headache, I got hot, I got dizzy. I felt very nauseous. And that went on till Sunday. I couldn't do anything. I just like stayed in the bed because my body hurt so bad from like my waist up. And after that, all I had was little headaches. But I went to work on Tuesday and I was fine. I've been fine ever since.
Thank you so much, Michelle.
You're welcome. You're welcome.
Very quick follow-up for you, Michelle. Can you just say whether or not those who are eligible for vaccinations at the Mason Square Neighborhood Health Center, are they available exclusively to Mason Square patients, or are they available broadly?
No, they're just our patients. Just our patients right now.
Thank you.
You're welcome.
Just based on that question, and I'm gonna move right over to Mr. Cotto and Mr. Walker, Ms. Helen, Commissioner Carlton Harris, for the Mercy appointments, do they have to be Mercy patients as well? Do you know that?
No, they do not. Mercy's site is a public site, so individuals can register for the Mercy site. However, in talking with Dr. Roos, I don't believe they have appointments available until the first week in March, but they are a public site. The Bay State is not.
Thank you very much. And we're gonna move over to Mr. Cotto and followed by Mr. Walker.
Thank you for the invite.
Thank you so
welcome,
much,
Michelle.
Michelle. It's great to hear from you. Thank
You
you so
too.
much.
Hey, thank you for the invite. My name is Alberto Cotto. I work for Numerous Citizen Council. I've been here like 23 years. So I do a lot of community work. Reason I got the shot, I know, for my community and my family. Basically, I got my loved ones at home. I got a 3-year-old boy and a 10-month daughter. And I'm the only one that goes out the house. I go to work and go out, in and out. And that's basically why I got it. And And as far as any side effects, the only side effects I got was my arm hurted a little bit. The second one that I got on the 17th, my arm is still hurting. Like even when I took a shower this morning, I can't really reach my back, and I can still feel it a little bit. But besides that, that was like everything that I got. And the reason, another reason is back in April, me and my girl went into Bay State to have our baby, and they tested us before we went in. When we came out, all three of us was positive with COVID. So you're not safe anywhere, you know. And I just take precaution today, and you know, I don't want to get infected, and I don't want to infect nobody. And that's the main reason that I took it.
Thank you, Mr. Cotto. And I know that we're a little bit over time, but if people just bear with us for 5 more minutes to hear from Mr. Walker. Thank you for sharing that with us. It's important to keep our family safe and the community, and you do great work in the community, Mr. Cotto, so keep it up. And thank you for keeping our safety at the forefront of the work that you do. Thank you.
Thank you.
Mr. Walker.
Thank you for the invite. I could speak for hours, but I'm going to keep it as short as possible.
We got 2 minutes.
I'm a healthcare worker. I've been an RN for 26 years. I've worked in HIV and AIDS for 3 years prior to that, and I was a direct care worker before that. So I understand health and community health. In March, this disease or this virus ripped Springfield and the United States apart. I was there. I watched people get infected at a rate in which I've never seen before. I watched the mortality in nursing homes go up to 20%. I was afraid. I'm gonna be honest. I seen people get sick on Thursday, die on Sunday. I just had a friend. His brother just passed away today. There are still people dying. My mother's 94 years old. I don't want her to get sick. My daughter's 5 years old with autism. I don't want her to get sick. We have to step up to protect those who can't protect themselves. And by protecting ourselves, we make a stronger community. So I had no doubt in my mind that when the opportunity for me to take the vaccine came up, I was going to take it. I took the Pfizer vaccine on the 6th. The first shot, I had side effects. I had upset stomach. I had headaches. I had fever and chills. It went away after a day or so. The second vaccine I took on the 27th of January, and I had no side effects. I didn't even have local pain in the arm. I literally I was like, wow. So I've been very happy about the results. I feel stronger. I feel like I can do a lot more in the community. Not because I'm safer, not because I can't pass it on to others. So I wear my mask. I follow the PPE protocol. And I've been involved now in at least 5 vaccine clinics. We vaccinated over 1,300 people. I've yet to see an adverse consequence yet. It's all been local. It's all been short term, and the individuals are getting through this. I'd like to see more people of color get involved. I'd like to see more people of color get this vaccine. So good job, everybody. Thank you for your work you're doing. And I'm always going to be an advocate. Thanks, bro, for calling me out. All right, I appreciate that.
Wow, Mr. Walker, that was so powerful and important to say that people are still dying. And so we know that it's important if you have access to take the vaccine, do your research, make an informed decision, but please, please, please consider it. You know, we're here to provide the information to you. We're here to give you personal testimony. People may have side effects, but they're okay. They're okay. So we want all of us to be okay. We want all of us. We don't want one more death in the country, let alone Massachusetts, let alone Springfield. So guys, let's just do our due diligence. do the research. We're here to provide the research. There's a bunch of information in the chat that Nicole is going to make sure we send out via email to our Mason Square community, and make sure you just distribute it to anyone that you feel needs this information, because there are a lot of misnomers out here. Lindsay Tucker from Department of Public Health on the state level, thank you so much. Phoebe Walker, our regional champion, thank you so much. Miss Helen Carlton Harris, thank you so much. And Dr. Pilar, Morales Pilar from Del Pilar from Bay State, thank you so much. You guys have been a great panel, so easy to work with. And 2-hour testimonies. It's so important that our people hear testimonies from people that look like us, right? That is always so important. So they know that you're still alive, you're still living, and you're gonna stay alive because you got the vaccine. So thank you for sharing your testimonies, Michelle, Mr. Cotto, Mr. Walker, Ms. Roberson, I should say, and Richard, Nicole, Anna Marie, the panel. Focus Springfield, we couldn't have done it without you. So we always want to thank you. Bay State, we want to thank you for your support. Anyone else that we missed thanking, we thank you anyway. And to all the participants that showed up to watch the long info session, we appreciate you as well. So with that, we're going to say bye. We did get a question from Cynthia about the senior centers. We'll get an answer for you from Miss Helen, but she had to leave, and Dr. Morales had to leave as well. So we'll get an answer to you about that. And Bay State does have a public center that gives out vaccinations in Holyoke, and we will also send you a link where you could find out information on that and schedule appointments there. And so we just want to make sure that we represent Bay State correctly, because they are a great partner to us at the Mason Square C3. And I will turn it over to Richard for closing remarks, and then we will say bye. Bye to our panel. We don't want to hold you longer. We know you got work to do.
Just want to thank you all very much and turn it over to Nicole, just so that she might remind us how to review this information on YouTube and on our chat. Nicole?
Hi, everyone. Again, this will be available on the Focus Springfield website and on their Facebook. Also, you'll be able to click on the link to see this video all over again. And also, if you have any questions, you can email me at the c3msquare@gmail.com at the Mason Square C3 email for any questions or follow-ups that you would like.
And finally, just want to say thank you, Anne Marie. You are a godsend, and the collaboration tag team between you, yourself, Brandon, Stephen, and Nicole, you guys rock. Thank you so much, panelists, and thank you all, Mason Square C3, for your participation. Let us spread this good news wide and far.
Can I
We couldn't
just
have
add,
done it
Tracy,
without you all. We couldn't have done it without you.
Tracy, we thank you. You're thanking everybody, but we thank and love you. You're
Indeed.
awesome, okay? We won't
I
forget
appreciate it. And Richard as well. We tagged you.
Yes.
That's right.
All right. Have a great day, everyone.
Bye, guys.
Thank you, guys.
Thank
Good work.
you.
Good work.
Good work. Thank you.
Okay. Okay. I think you did it, Trey.
I think we did it.